Good morning, everybody. Once again, Dr. Salim is here with you guys. And today's a very interesting topic we're going to discuss about that, which is everybody needed for all those healthcare providers who put their diagnosis on the images. So I'm pretty much sure that with all these imagings, like when we do with the sonography or with the ultrasound, or commonly we can say you took a picture with a probe, you will need this today as a chapter or lecture or topic. Better to go for the depth of understanding of it. It's called Doppler shift. So if you're scanning OBGYN, general abdomen, small parts, even if you do MSK, TCDs, vascular Doppler, echocardiography, so in all these imaging, for sure, you somehow, somewhere, you will need to know the correct understanding of the Doppler shift. What it is, how it works, what is the mechanism, and what is this phenomena? Let's clear it because those who are performing all these studies still somehow they're confused. Like it's not clear for them. So let's talk about this today. Okay, what is these things? What is a Doppler shift and how we can get to the better understanding of it? Let me share the PowerPoint with you guys and let's discuss it from this point. Be with me. Okay, so I hope you guys can see the screen I share with you guys. So we will talk about all Doppler shift and Doppler effects, how they works, what is this phenomena. So let's see what is from the Ecumenical Center Institute. What's the point of view? How we can make it easier for understanding. Let me talk about them. So let's go one by one. If we look at here, for the flow Doppler or Doppler shift or Doppler effect or Doppler studies, we have to know the definition of it, what it is, how many types of Doppler shift we know or Doppler studies do we should know or we will be able to know that because these things you may need it for your practice daily or maybe you're a student and you want to know the depth of this. You want to know to clear those questions you have it with you. Or if you are an instructor, teacher, you are teaching somewhere in the universities, colleges, institutes, somewhere we really want to know that how it works. Or maybe if you're sitting for national or international examinations, I think it's better to know the mechanism, the technique, and to clear this concept actually about the Doppler studies. So what are the types of them? And explanation of them and examples of them, and also which formula and angulation we need to know about the Doppler studies. And also sometimes possible artifacts can happen too. So how to avoid from the artifacts and how should we know this is artifact and this is pathology. So we should distinguish between them that way. Now, let's talk about the flow Doppler or Doppler flow. What is a flow Doppler? Normally, if we're talking about the color Doppler. So let's talk about the color Doppler, like what it is. We want to know the direction of the flow because we all know that as a medical professional, we know that what is a normal flow, like which direction the flow is going, that is the normal direction, and what is the abnormal direction. I will give you one example. For example, if you're looking, for example, you're looking at a four-chamber view of echocardiography to the heart, and you are scanning that four-chamber view, apical four-chamber. So we know the normal direction is the flow from the left atrium supposed to go in the diastole. It should go to the left ventricle, and then when diastole is done, then the valve, the mitral valve, has to close completely. If you see that the flow is coming the opposite direction from the mitral valve, it means something is wrong. And that's like we call it mitral regurgitation or MR, or there's an insufficiency. It's just an example I'm giving you. So we want to know that the flow is going to the normal direction or abnormal direction. That's one thing. Or simple, you can make it this way more simple, like the flow for the systemic circulation. The flow is leaving the heart and going to the tissue distally. So it's a forward flow. It's not a reverse flow. It's not a retrograde flow. It's an antigrade. It's forward. It's not coming backward. So that is a normal direction of the flow. If we find it the back way is coming, that's abnormal. So we want to know the direction of the flow. Is the flow normal in a vessel or abnormal? Like, for example, in the veins, peripherally venous system, the blood is coming backward. It's coming to the heart. It's supposed to not go to the distal. It's not supposed to go like backward. It's supposed to come to the heart, not away from the heart. In that case, there will be a venous insufficiency in case if we find it the wrong direction, I mean. Now, the other definition can be, we can say the difference between the frequencies. Means we have a probe of a specific operating frequency or initial frequency. What happens? The flow, the frequencies of the transducer, they go inside of the tissues and then reflect back. So how much we transmitted the frequency and how much we receiving back. So that is actually, we can say, the difference between these frequencies. Or the other word, you can say subtraction between the frequencies, like a reflecting frequency minus initial frequency. This will be another definition. We can see a Doppler shift. The Doppler effect is actually, that's the process. And Doppler shift is the result we see on the display, on the monitor, on your TV. That's what we see. Either it's red, either it's blue, or maybe it's the mix of both of them. So you see a positive shift and you see a negative shift. So that is the subtraction between the operating frequency and reception frequency. That is another definition. Maybe somebody may say, make it more easier. We can say the flow of one direction or multiple directions. We want to know about the Doppler or color Doppler shift. We want to know, is the flow going to one direction? Is it like just solid one color, or it's going to all direction and you get the mix of the colors? That can be another definition. Or you can make it this way. You can say like normal laminar flow or pathologic turbulence flow. So that's also a color Doppler can give us this information. Or maybe we can say flow towards the probe or flow is going away from the probe. Where you put the probe on, for example, you're looking to the carotid artery. If you put the probe on the carotid artery and you're angling more towards the trunk area, we know the flow is coming from the heart and going to the brain, for example. It go up and your pulses are going down. So they go completely opposite of each other, correct? So in this case, we can see that the flow is going towards the probe, like probe is here and the flow is coming toward. Or meanwhile, the internal jugular vein, the flow is going away because the pulses are also going down and the flow from the jugular vein is normally also going down. So they're going on the same direction. So we want to see, is the flow going towards the probe or going away from the probe? It's supposed to represent on the screen with a different color for identification, internationally accepted. Any flow which is towards the probe supposed to be in a red color. It's just color is just identification. The real story, the real mechanism behind them is towards and away. Any flow, it's not necessary to be a blood, any flow. When they are going towards, like this is a camera, it's coming towards the camera or it's going away from the camera. So that is the probe. Is it going towards the probe or going away from the probe? That is another explanation of the shift, or we can say Doppler shift we can see. Now, again, we can say the difference between the transmission and reception frequencies can be a definition like or explanation both. Like somebody asks you, what is a Doppler shift? We can say it is that difference when we use a probe with a specific known frequencies. For example, 7 megahertz probe you're using for the in a Doppler shift somewhere in the body part. So your 7 megahertz is constant. That is not changing. But the change will only seen in the reflection. Either you get more reflection, what you operate, or you get less reflection, what you operate. For example, the 7 megahertz transistor you're using, you may get more than 7 megahertz extra, like you get more reflection, or you get less than 7 megahertz back, like maybe 6.999 megahertz, or you get more reflection, like you're using 7 megahertz, but you get 7.001 megahertz, you get more reflection. So that is the difference between the transmission and reflection. That's why we see either towards in a way. That difference is a little bit, but we see it. Now, let's make it more clear. These are the types of the Dopplers. We have color Doppler, we have power Doppler, we have pulse wave Doppler, we have a continuous wave Doppler, and we have a tissue Doppler. These 4-5 different Doppler studies are helping us to reach to a diagnosis. Sometimes we need only color Doppler, and that helps us, and that make our diagnosis easier. Sometimes that's not helpful. We need to do power Doppler. Sometimes both of them are not helpful, not that much helpful. We need to do a pulse wave Doppler. That's for a specific another studies, but it's still Doppler. It's measure the movable structure, and that movable structure can be anything. It can be blood, it can be urine, it can be a tissue, it can be anything, which is just dynamic. And then sometimes even pulse wave is also not really helpful. We use another modality, and that's called continuous wave Doppler. And then sometimes we use a tissue Doppler as well. These are all the different Doppler studies which help us to reach to the diagnosis like really close and put our diagnosis with a confidence. Now, today we only discuss color Doppler. The other studies, these other 4 studies, we will do it step by step, but let's today just focus to the color Doppler, what it is and how it works. Be with me. Let's discuss that. So as I mentioned earlier, you can see here. Now, this is a color Doppler. What we have, this is abdominal aorta. You guys all know this. Now, we know the flow from the proximal abdominal aorta is going to the distal portion, right? So now we know that the flow is going towards, because this is a probe area. The probe is here and the pulses are coming down, right? It's just coming down and the flow is going that way. So it means the flow is towards the probe. It's going towards the probe. Meanwhile, if you look to the hepatic veins, they are going down. They are going away from the main source of the pulses, which is the probe, right? So it's going away. That's why you get a less Doppler shift from these hepatic veins, and you get more reflection and back in return from the abdominal aorta. We just talked about that earlier. This is here. Now, determined by the receiving frequency. Color Doppler, to see that is it blue or red, or is it towards in away, is it negative Doppler shift or positive Doppler shift? Everything, remember, it can be a question somewhere in national or international. It's determined by the receiving frequency. The reason is we are using, pretended this is a 5 megahertz transducer. So your 5 megahertz transducer is constant. It's 5 megahertz. The only change you see in the reception. Do we get more than 5 megahertz in return, or do we get less than 5 megahertz? So like this is a very good example you can see here too. With these hepatic veins, we get less than 5 megahertz because the flow is going away and the pulses are also going away, both of them. I will give you a very simple example. Pretend it. This is in my hand. This is a tennis ball. You can squeeze it. So now pretend it. This is a very good example. It can adjust here. If a car is coming towards you, close to you, and you throw this ball, this tennis ball, on the front of the car, so this ball is going in a specific speed towards the car or the vehicle, and then the vehicle is also moving towards you. So that's one situation. This tennis ball will bounce back. When it touches the car or vehicle, it will bounce back. And now pretended the other position is the car or the vehicle is going away from you. And the ball, the tennis ball, you throw on the back of the car. So now tell me, which way it will return back quickly? When the car is going away from you, or if the car is coming towards you? Exactly. When the car is coming towards you, so that is one force, and this, you throw this ball, this tennis ball, and that hit the car, and then bounce back. When they bounce back, the speed of the bounce back is a lot more than what it went in the transmission mode. So if we throw it, I was not that speedy when they come back. Exactly, that's the same story here you can see in this blood flow. So the flow between the reception here in abdominal aorta, we get more. than the operating frequency. Oppositely, in the hepatic veins here, you see, you get less reception compared to what you operated with the frequency. So operation frequency were more than these hepatic veins, you get the blue color. So that is a negative shift. So here is the formula. You can see the reflecting frequency minus initial frequency, or operating or transducer or starting frequency, same thing. So remember, our dominant factor here is reflecting frequency. The Doppler shift will be selected by the reflecting frequency because your initial frequency is constant. That's not changing. So only change will be seen in the reflecting frequency. And again, if somebody maybe somewhere they're going to ask, because this Doppler shift is very little, that's why the unit for them are kilohertz, not megahertz. And then maybe somebody may ask this question like, what is the best Doppler angle and why? Remember, the zero angulation is the best Doppler shift angle. Why? Because if this aorta, if you take it, for example, we can see this aorta, and here is, you can see the celiac trunk, correct? The first branch of the abdominal aorta, that's the celiac trunk or celiac artery. So if you see here, the flow from the aorta goes inside to the celiac trunk. Now, the celiac trunk and the main axis beam of the sound beam, they are parallel to each other. It means there is a zero angulation. And zero angulation mean, because this is also going by the we can say the cosine. The cosine of zero is 1, and 1 mean 100%. So remember, the Doppler shift we get here compared to the celiac trunk, it's little. Celiac trunk will give you full Doppler shift because you are more zero angulation. The main axis beam is more zero angulation to the celiac trunk compared to the abdominal aorta. So remember, the best Doppler angle is zero angulation. Why? Because the cosine of zero is 1, and 1 means 100% Doppler shift. You cannot miss a very small amount of the blood. You will catch it because either the flow has to be towards or completely away. So it's 0 degree angulation. We're going to talk about that later a little bit. Okay. So now, once again, like I mentioned earlier, you can see here too, if this is a vessel, pretended, if it's a vessel, the blood is coming that way, and this vessel is, it's like a curve, pretended. Pretended, just like this is aortic arch. We have ascending aorta, transverse, and descending thoracic aorta, correct? So just pretend it that way. Now, the flow, if your probe is here, this flow is going towards, and the pulses are coming down. They are front to each other. They're like just completely opposite direction of each other. You see, the flow is going up, and then this pulses from this probe is coming down. So they're completely opposite of each other. It means you get more reflection from their accident, from their, like when they interact to each other, you get more reflection. This probe, if this probe is 10 megahertz, you will get 10.1 megahertz back in the reception. But if you look at in this portion, the last one here, you can see that this one is going down. The flow is going down. The flow is going away. And the pulses are also keep going away. Now, in this case, if the same probe, which was 10 megahertz, here is also 10 megahertz. Now, remember that tennis ball example I just gave you guys earlier? Exactly same thing. These pulses are hitting the flow from the backside, and you get less reflection. I mean, if it's a 10 megahertz, you may get 9.9999 megahertz, but it's less than 10 megahertz. What happens, again, somebody may ask you that question, that what will select the Doppler shift in the frequencies? Is it operating frequency or receiving frequency? Remember, it's always receiving frequency. Because look, here was also 10 megahertz, here was also 10 megahertz on the operating. But here you get more reflection, receiving frequency. Here you get less reflection. Again, it's a receiving frequency. So that is the phenomena between positive Doppler shift and negative Doppler shift. Red color, internationally accepted. It's just for identification. Blue color, again, it's just identification, nothing else. And that is your negative Doppler shift. Remember, again, for us, Doppler shift is actually, we really want to know the flow is towards or the flow is away. That is the main concern. That is the concept of Doppler shift. If the flow is going towards, that will give you more reflection, and that's a positive Doppler shift. But if the flow is going away from the transducer, that means you're getting less reflecting frequency, and that will be a negative Doppler shift, and that will represent as a blue color. But towards is a red color. A color, remember, once again, color is just, it's just for identification. Color has no meaning other than that. The important thing is towards and away. That is the most important. Now, I just find this example, like if you look at here, the flow is in this vessel, the flow is going that way, right? From this point is going that way. Now, if you're using pretended, you see those reflection, you see. So pretended those reflections are high frequency, you're using more frequency, but in return, you get less frequency. It means this is a negative Doppler shift in that case. Or you can see in this artery here, artery and vein, so you get here, because this flow is going that way, this direction, and the blue flow is going away. Now, the box itself is an angulation. The pulses are not coming straight in the box. They're a little in angulation. So for these red color, the artery you see, the pulses are getting completely like opposite direction of the flow, because the flow is going to this direction and the pulses are coming down. So they're completely opposite direction. But with the blue here, pretended this is carotid artery and that's jugular vein, pretended. Now the flow in jugular vein will going away and the pulses are also going behind them. So it means you get less reflection, and that will be represented as a blue color. Or again, if you look at if there's an ambulance which is going away from you and coming towards you, now we understand the sound of the siren is more getting more higher and louder when the ambulance is coming close to you. But the person who have the distance from the ambulance, which the ambulance going away from that person, you will get less sound, and it will disappear after that. So that is the same concept between the pulses away and towards to the flow. That is important for us. Remember that. And let's see next. This is a better example also for the Doppler shift. Now, if you look to these two are a better example. Just pretend it. Look at this probe. It's using less frequency, but receiving more frequency. Remember, for example, if this is a 7 megahertz transducer and you get 7.1 megahertz and back in return, it means the flow is towards, and it's supposed to be in a red color. But oppositely, look at here, if your probe is a 7 megahertz frequencies, but you get less frequency in the return, you get 6 maybe like 9 megahertz. So you are having more in operating frequency, but your reception is less. It means your Doppler shift is negative because the flow is going away from the transducer in that case. This is important for us. Meanwhile, if you're scanning carotid artery in jugular vein, internal jugular vein, one is blue, one is red. In case if you hold your probe, for example, this is my probe. If you hold the probe this way, so I understand the pulses are going towards the trunk. And from the trunk, the CCA or common carotid artery will take the blood towards the probe. So in that area, your carotid artery looks red. But meanwhile, jugular vein is draining the brain. It's just going down to the trunk. And the pulses are also going to the trunk. In that case, both of them are in the same direction. So you get blue for the jugular vein. This example is a really good example. Let me help you in one thing. There's another one. You see this. If the operating frequency and receiving frequency are the same, when you get the same amount, you are using 5 megahertz and you're receiving 5 megahertz for the color Doppler. Remember, that means you do not have any Doppler shift in that case. It means you are in a 90-degree angulation. You will be not able to see any red or blue or mixture of them. You will not see none of the above. Because remember earlier I just mentioned that Doppler shift is the subtraction between the operating frequency and receiving frequency. There has to be a little difference to see that it is towards or away, it's red or blue, is it positive shift or negative shift. You have to have that sum of that subtraction to have something in your hand. If you don't have anything in your hand, Your operating frequency is 5 megahertz and your reception is also 5 megahertz. So there's nothing left for you. You don't have anything with you. So there is no Doppler shift. The vessel look empty. That's just an artifact because you're using the wrong angulation. Maybe you're just completely 90-degree perpendicular on that case. Okay, so this is a color bar. The 0 point is the baseline. Anything above the baseline will represent positive Doppler shift. This room is for Doppler shift, which is positive, which is towards. Doesn't matter. It's a blue color or it's a red color. That's not have meaning. Like in this example, you can see both of them. Look at here. This color bar is for this artery. So the shift, just they invert it. Otherwise, this is a positive Doppler shift. It's just the color is blue because somebody invert that button. And also look at the angulation. Here, the angulation for this vessel is the box is steered to the left. And here, the box is steered to the right. I will mention one more time. If you hold, in case, if this is your pro, my mobile, yeah, now you can see it. So if this is if I hold this on my CCA completely 90-degree, you will not receive any Doppler shift. It does not mean that I don't have a blood flow in my CCA. I do have. But the thing is, you're using the wrong angulation. It's a 90-degree. It's a perpendicular. But if you hold it this way, like towards, you see now? So that is still the color bar above the baseline is for the Doppler shift. Now that's a positive. That will be this angulation, the bottom one. You see this one, this one. So it is this one. But if I hold the probe this way, now like you can see it, I holding this way. CCA is still the CCA, common carotid, and it's still the artery. It has the correct blood flow. The flow is going forward flow, but now the color change and it become like this. It's become blue. So it does not mean that here is a problem. No, it's not a problem. I just changed the angulation. So still the flow, if you look at here, still the flow is in a positive area. Doesn't matter. The color is red or blue. That's not it. Like I said, color is not important. Color is just identification. We want to know the towards area is for positive and the one which is away is for negative Doppler shift. Now, if this is my artery, I have to invert it back to get it color as a red on that case. So because it's identification, if it's not a pathology, you have to make it red because there is no pathology. It's a normal. It's just away towards, correct? Okay, let's keep going. Now, this is another example. Like, for example, you can see here, you can see these, like you're using the same example, just we had it earlier, like you're using the black arrows that is pretended they are your operating frequency. The red is your towards, and then here, I try my best. My nephew, actually, he did this for me, a good job, actually. So what he did, yeah, I just told him, make these arrows, which is in the red color, they are like a little bigger, like a little, we can say thicker, and then make the blue arrows a little thinner, smaller, like very smaller. So if you look at here, there will be less frequency, and the receiving here on the red one is, I will play one more time, and there will be like a little more. For example, if this probe is 6 megahertz, and the red one, it's a little thicker, you can see it, right? So they have pretended they're 6.1 megahertz. But the blue one here you receive, they're a little smaller. We can say like a thinner arrows are coming back. So pretended it's 5.999 megahertz. So we get less reflection. Meanwhile, same, for example, this is the same artery. It just have an arch. So remember, same artery, blue, red towards and blue away. Okay, here is another that's also made by him. Qadir made it for me. He's like only 15 years old, but look at the technology, how they make these things. So again, the flow is going away. You see that? Away. And the pulses are also going that way. Like the flow and the pulses are on the same direction. The flow is going away and the pulses are going behind them. So it's the same direction. So I try to make the towards arrows a little bigger, thicker, and then the reception are a little thinner. So it means you have a negative Doppler shift here. Correct? That will be another example. Again, it's again one of the example you can see here too. You see the flow is coming towards here. You see that? And then you get a more stronger echoes from here. And here, if you look at this one, so here you see that you are using more flow, you are using more transducer, more frequencies, higher frequency, but in the reception, in the return, you get thinner, smaller arrows. Just for to make this phenomena clear. So if you look at these arrows, they are a little bigger, thicker. And then if you look at the blue ones, so they are a little bit thinner, smaller, correct? So, and look at the flow. The flow is coming away. They're going away. You see that? And here in this example, you see the flow is coming towards. So you get these arrows a little thicker than the green ones. So it's just for identification to tell you, this is another formula. You see this formula? We had two formula for the Doppler shift. One was reflecting frequency minus initial frequency or operating frequency. And that will tell us that what is your Doppler shift and how much is your Doppler shift. This is another one. So we say 2 times operating frequency times velocity of the RBC times cosine of angle or theta. Everything divided by the propagation speed of the sound in a soft tissue. Remember, if somebody asks you the question, now here, if you make, like earlier we said, the worst Doppler angle is 90 degree, perpendicular completely. Why? Because cosine of 90 is 0. If you multiply 0 with anything, the entire sum will be 0. You will not have any Doppler shift in that case. And then the best Doppler angle is 0 angle. If you put the 0 angulation, in that case, for example, if you are looking for the peripheral arterial and venous system, the 0 angle will be when you are using a catheter inside of the vein or the artery. That's a 0 angulation. But in echocardiography, if you're making, for example, if you make a 2-chamber view, correct? So the flow is completely parallel to the main axis beam. That's a 0 angulation in that case. Okay. And the 0 angle is the best because the cosine of 0 is 1, and 1 mean 100% in that case. Okay. Just in case. Again, you can see this Doppler shift, the positive and negative Doppler shift towards the innervate from the transducer. Look at here. Now we have the same color bar, right? The positive shift red and the negative blue below. So that's negative limit. Here you see the positive Doppler shift area, the negative Doppler shift area. Here, we see the box is like this, right? The box is steered to the right. It means the pulses are coming from the left to the right. And then the flow is going from the right to the left. So it means the flow impulses are completely in opposite direction of each other. That's why when they interact to each other, you get more reflection. That example of the tennis ball, remember, like if you throw to that vehicle, that car, which is coming towards you, and you throw this ball, so what happens? The bouncing is more than operating. It will quickly back come to you compared to when it was going towards the car. So that's why they are completely opposite direction of each other. Somebody may ask you this question. They will tell you, look at these RBC. If you're using the probe here, right, the pulses are going that way, and the RBCs or the flow are coming towards this way. So they are completely opposite direction of each other. You get more reflection. And that's why your Doppler shift is positive, because you get more. What you use, you get more than that. So in this case, look at here, the flow is going away. Now the box steered to the left. So it means the pulses are also going to the left, and the flow RBCs are also going to the left. They are going in the same direction. So here, what you used, your returning is less than that. You lost something here. So here you have negative Doppler shift in that case. Or you can see here, superficial femoral artery and superficial femoral vein. SFA and SFV. And the same area, look at here. This flow is going that way, and this flow is going this way. So for this vein, the flow is going with the pulses. They are in the same direction because the box is steered to the left. It means this flow is going away. And also on this one, the flow is going that way. So the flow is going completely opposite direction of the pulses coming from. But here, this vein, they are going in the same direction. That is something we can say the Doppler shift is positive or negative. Important is the flow going towards the pulses or going away from the pulses? That is important, remember. That will help us. Again, like I mentioned earlier, it's not important to be blood. It can be anything, which is it's a flow. Any flow can be. Look at here. This is urinary jets. So it's urine, it's not RBCs, it's not a blood. But why they look red? The reason behind it, because they are coming from the catheter, the ureter, sorry. The ureters are entering to the urinary bladder and they're just, draining to the urinary bladder. The urine are coming and draining to the urinary bladder, but their direction is towards the probe. You see that? The pulses are coming down and they're going in front of them. So they just go completely opposite of each other. So what happened? They look red. If they were the other way around, it will look blue on that case. But it's going towards and they look red. So here the machine, the ultrasound unit will detect the movement. So our detection of the flow is important for us. Not only RBCs, so we can say, oh, here's the RBC, here's the hemoglobin. It's a more saturation of the oxygen. That's why the artery look like red. There is less oxygen saturation or more carbon dioxide and the venous flow, and that looks blue. That's a totally wrong concept. Please don't go by that, because some people I hear from them, they say the vein look blue because it has more carbon dioxide and the saturation of oxygen is less. And artery looks red because it's more oxygen. That is a totally wrong conception. It's not that way. It's towards in a way. That's important. How about this? If they're still on this idea or believe that the vein is blue because it has more carbon dioxide or it's less oxygen saturation, how about the urine? There is no carbon dioxide, there is no oxygen. How about that? So that's not the reason. The concept is towards in a way. Please keep in mind and clear that concept. You can do pulse wave Doppler of them too. They will give you, because there is a move. We just detect the movement actually. So again, look at here. This is a vein. Here, the veins, the superficial femoral vein and the deep femoral vein, they get together to give you common femoral vein, correct? So the flow here on the veins is going towards the probe here, because the box is steered to the left. They are going towards. And look at here. We get blue in the Doppler shift of the positive area, but we get negative shift area as a red. So they're telling you that this area, this is an artery, we understand, but it's in the wrong angulation right now. So what we do, maybe you get a very perfect angulation, like the perfect filling of the vessel. So because this is a good filling for the lens, what you do, simply invert the colors. So in that case, we invert this and you got the artery as a red and vein as a blue, because that's universally accepted. The vein has to be because we have to distinguish between them. Supposed to be not the same color, right? Has to be different colors. So original, the mechanism originally, the phenomena was that this is supposed to be blue. This artery has to, why? Because the pulses are going away. The flow is going away from the source of the pulses. Pulses are coming this way and the flow is also going on the same direction. So here it's supposed to be blue. And this vein is coming, this flow is coming towards the source. You see that? It's coming towards. So they are front to each other. In that case, this is supposed to be red. But we cannot represent it that way. We know that there is no pathology. It's a normal flow. So that's why the color was inverted from here. Normally, this is the correct way of the color bar to be. The red has to be above the baseline and blue, which is negative Doppler shift. That room is for the below the baseline, and that's a negative Doppler shift away. But here we inverted. So this picture has been inverted actually, just for identification, just for better presentation, actually, we can say. Remember that. Please do not forget that. Here you can see, this is the best example for towards in away for the Doppler shift. ARDMS, American Registry for Diagnostic Medical Sonography. If you want to sit for SPI exam or RDCS, RVT, any of these examinations, they may ask you this question. Look at these examples. So they will give you this picture and they may ask you for this, and they will tell you the patient has no disease, no problem. Everything is normal. Adjust the physics in this picture. So what you do, you only have to invert the color, because in our case, we understand This flow is going that way. That's why it's red. That's the originally it's a look like that. But we have to invert it because this flow is going away. You see that it's away. But here for this angulation, it is towards. So that's why it looks, both of them are peroneal veins. So both of them peroneal veins, they have no pathology, but they are towards the probe. You see that? And they become red normally. But here, the peroneal artery, in its technically, it's away because the pulses are also going this way and this flow is also going that way. It's away. We cannot present universally. The protocol is you cannot represent this picture to print it and give it and put it in the file of the patient. You can't, because this will be representing as a pathology, even there is no pathology. So what you do, you have to invert. That inversion will help you to make the vein as a vein, represented as a vein, and artery as an artery. Otherwise, this is totally opposite because this flow is not coming this way. This flow is going that way, like here you can see. So sometimes that invert button or knob in the machine it is for this adjustment we do. So, and if they ask you this question in ACPI, what you do, simply just click the invert button and now you're good to go. Instead of representing this picture, you will represent this one, which is correct. Or you can see here in this picture, same story. This is common femoral artery, and it just bifurcate, for the superficial femoral artery and deep femoral artery or profunda femoris. So what happens here, the box is to the right. Compared to the left, it's to the right. So flow from here, it's going from the left to the right, and the pulses are same thing. They're going from the left to the right here. So technically, this is supposed to be blue, but it's an artery and it's a normal artery. We cannot present it as a blue. So the color bar was inverted. It says whatever is blue, make it red because that's a positive Doppler shift area. This parking is for the Doppler shift of positive. Doesn't matter below in the picture what it is, but that has to be red in the picture if you invert the color. Look at here. Here, this area is red. We want Doppler shift to be positive for this artery, and then that's positive now. You can see here. Here, these two pictures, almost the same thing. This is like earlier we talked about this SFA, and look at here, SFV. So now if you look at here, this is technically, it's supposed to be blue, but we cannot represent it. And this has technically supposed to be red, but we invert it. So it is inverted. We have to. That is allowed. That is a legal move. You can do that, no problem. Again, once again, you can see, again, I will just represent this. Look at this color bar and look at this color bar. I hope this phenomena will be clear by now. Look at here. This is a positive shift area. So your jugular vein flow is going this way. But look at here, this is your jugular vein. If the box was like technically here, this way, the jugular vein was red. Why? Because the box steered to the left and the flow is going that way. Now the pulses are coming opposite of the flow. They go front to each other. So I cannot represent this picture anywhere in a file of a patient because I see that the patient has no problem, completely normal patient, just the box steer to the left. And it will represent that the flow is going that way and the flow and pulses are completely opposite direction of each other. And in the jugular vein, it looks red to me. But like I said, click that button or that knob which says invert. And now this picture is more diagnostic compared to this one, if the patient has no problem. If there is a problem, for example, the patient has a reverse flow in the jugular vein, and you prove that, maybe there is an insufficiency, there's a leak, then do not invert it on our case. But in this case, I see that there is no problem, no sign symptoms, and I don't find any pathologic evidence. In that case, I have to invert it because it's not red. It's just because of the physics it looks red, not because of the pathology of the patient. It's just the physics. So I have that right to invert it. So what I did, I will say blue, you stay in the positive area, even though that's towards, but the color has to be blue. Only the color we did blue, still the flow is towards. And then the one which is away, I will say you stay red, but you're in the negative shift. You are, because the flow in CCA is going away and the pulses are also going away. It is in the negative shift area. The parking is still the parking. It just we cover them with a different cover actually. We give them color. Okay. That's another example. And once again, somebody may ask you this question. Still, some people are confused who perform these studies. Even for the radiologists, these clips are really good. I think they help them. Like you will know that your technologist, ultrasound specialist, sonologist, the person who give you the studies. So if you are a radiologist, the final doctor who finalize the report. If you are a radiologist, medical specialist, cardiologist, the one who finalize the report, simply. So we should know that is my operator who operate the study. Doesn't matter if it's any healthcare provider. Is he or she performing the correct physics or not? This is important for us. Now, if your vessel is tilted to the left, make sure your box also steer to the left. That's the physics. If your vessel is tilted to the right, make sure your box also steer to the left. That is important. Like look at here. This vessel is tilted to the left. In these two, the box is wrong. Even though they give you information, but it's wrong. It can make mistake. It will give you errors. It will give you artifact image and will disturb your diagnosis actually. So remember, if the vessel is tilted, doesn't matter, it is artery or vein, but the vessel is tilted to the left, make sure the box is also steered to the left. If it's to the right, and then to the right, that is the correct way of the box. Simple and easy. Here you can see too. So we see the vessels are tilted to the left. The box is also steered to the left. Now, we know this flow is going towards.